Good evening, everyone. I hope you all are safe during this pandemic situation. In my earlier videos, I had explained you about different ways of managing dental problems at your home during this lockdown. But there are also some situations when we need for emergency treatment, that is dental emergency. So, in which situations we need to call up the dentist. But kindly make sure to call up your dentist before making any visits to clinics or hospitals, because dental profession is taken as one of the highest risky profession, as dental procedures generate aerosols which carries the infection or increases the risk of cross contamination between the patient and the dentist. And so, if someone is asymptomatic and is the carrier, ultimately you'll be putting yourself or your entire dental staff, your family members, your community at risk. So, kindly before breaking the isolation, make sure it's an emergency situation. It's a request to both patient and dentist. So, what is dental emergency? In general, any dental problem that needs immediate treatment to stop bleeding, alleviate severe pain, or save a tooth is considered an emergency. This consideration also applies to severe infection that can be life-threatening. If you have any of these symptoms, you may be experiencing dental emergency. So, dental pain, but not all pain are emergency situations. Kindly call up your dentist before making any visits. Rinse your mouth thoroughly with warm water. If the toothache is caused by food stuck in your teeth, try using dental floss to dislodge it. Otherwise, apply a cold compress while waiting to see the dentist in order to alleviate pain and swelling. Infection. Anything that looks like a small red bump or pimple anywhere in your mouth is a good indication that an oral infection is present. So, kindly call up your dentist and meanwhile, rinse with a warm salty water. Next, abscess. This is an infection that is around the root of the tooth. It is a serious condition. See a dentist immediately. While waiting for the dentist, rinse with warm salty water to clean your mouth. Dental trauma. Save any pieces of the tooth. Use warm water to rinse your mouth. Apply gauze if there is bleeding for 10 minutes and use a cold compress on the outside of the tooth to help with swelling while you are waiting to see an emergency dentist. AVULSION or knocked out teeth. It is one of the most serious injuries and prognosis is very much dependent on action taken at the place of injury and promptly after the avulsion. If a child's baby tooth is knocked out, keep the tooth moist by putting it in water or milk. See a dentist as soon as possible to determine if tooth can be replaced. If an adult tooth is knocked out, keep it moist. You can try putting the tooth back into the socket. Make sure you hold the tooth at the crown, that is top part of the tooth that you see usually. Being careful not to touch the root. If this is not an option, try keeping the tooth between your cheek and gums or place it in milk. Go to a dentist immediately. So now you all must be knowing what should be done if it's a knockout. Jaw fracture. Gently align jaws. Do not use force. Immobilize jaws by wrapping a bandage under the chin and tying it securely over the head. Apply ice to control swelling and bleeding. Seek emergency care. Consult an oral and maxillofacial surgeon immediately. So, if your tongue, gums, or lips are bleeding severely, rinse with warm salt water. Use moistened gauze to apply pressure to the bleeding area. Hold for 15 to 20 minutes or until bleeding subsides. If the bleeding does not stop, go to the emergency room. Lost feelings? As soon as you can, take a trip to your local drugstore or pharmacy and pick up some dental cements, gauze, or cotton balls and cover the hole with any brand of oral cement. So now, I hope you all must be knowing when to seek emergency dental care. A tooth gets knocked out. If a tooth is broken, a tooth is knocked out of alignment or position, uncontrolled bleeding, sudden and severe tooth pain. If you have a dental abscess that is not getting better. Now, what are the myths about dentist? Rubbing whiskey on sore teeth during teething. Not recommended on children. Your genes will reflect the quality of your teeth. Not always. You still need to maintain oral health. White teeth equals healthy teeth. Wrong. White teeth does not mean they are free on cavities and infection. Brushing regularly will keep bad breath away. Not really. Dry mouth is often the cause of bad breath. Baby tooth does not need care. Wrong. They form the foundation of healthy teeth. So, to conclude, do not go to your dentist or dental clinic or hospital unless it's an emergency. Make sure before you visit the clinic or hospitals it's an emergency situation and you are in actual need of emergency treatment, and kindly call up your dentist. And your dentist, kindly screen your patients over the phone before taking up any cases. And if it's an actual emergency, kindly take up the cases. Make sure you screen the patient as soon as they arrive at your clinic. Take proper history. Make sure you and your staff are covered in proper personal protective equipments, and make sure you wipe all the door handles, dental chairs, washrooms, and everything. Kindly don't put yourself and your staff, your family members, and your community at risk by being a carrier. So, kindly stay safe and don't break the isolation unless it's an emergency. Don't be panic, we'll definitely get through it, but we also need to take care about it. Thank you. Stay safe.